Well, thank you very much for that introduction, and thank you everybody for having us here. I'll be kicking off this session, I believe, and I think I'll just get right through mine because I think Dee and Sandy are a lot more fun than I am. So we will get off, but I will share a little bit about where I am, where I come from, because I think it's important for, if I'm speaking for you, to understand who I work with or what I do and who I work for. And then a little bit about hunger in Iowa. Since this is hunger with children and families, as it relates to children and families, I think it's important for everybody to know what hunger looks like in Iowa. There's a couple of recent studies that came out within the past couple of months that paints a more accurate picture on who's visiting the food pantries in Iowa and who is actually hungry in Iowa. So we'll share a little bit about that. So I have a few slides. I'll really fast forward through the first few slides because although I think it's important, I think why we're all here is nutrition and hunger, so I'll share a little bit more about the programs that the food banks share that deal with nutrition and families. So we'll get right going. There's the agenda. We'll slide right through that. You'll see on the bottom of that, we're going to talk about, I'll just mention 2 or 3 of the highlighted programs. The backpack program, a lot of you, especially if you work at the schools, and the communities, the food banks, they have backpack programs around the state. We'll share a little bit about that, what that looks like, and then the Great American Milk Drive with the Midwest Dairy and the Dairy Council, and then I think I'll share a little bit about nutrition education. That's a hot topic now. That's more going to the food bank level program, but the association, we have had a couple projects related to that. So who we are. The mission of the Food Bank Association is to coordinate the efforts to alleviate hunger in Iowa by supporting the food banks and the Feeding America food banks in Iowa. So there are 8 different food banks serving Iowa. You could look at it as the food banks, the association serves the food banks, so we support the food banks. The food banks then receive the food, they distribute food to the food pantries, all the agencies around Iowa, and then the agencies, the food pantries, the congregate meal sites, the senior centers, the daycares, the churches, they then feed other community members around the state. The association who I am with, we work with all 8 food banks, so all the food banks all the food bank directors serve on the board of the association. We work on a lot of the policy stuff, the policy and advocacy, SNAP outreach. We have a state contract for education and assistance, application assistance. We also do food and fundraising for the food banks, as well as any other program, especially a disaster coordination, disaster preparedness coordination with the food banks and the community we're working on right now. Just a little bit, I mentioned this, I won't spend time on this. The Food Bank Association, we work in partnership with the food banks. The food banks serve the agencies, pantries serve the community. So if you're not completely familiar with food banks, that is the structure. So in other words, we support the food. So there are over 1,000 different nonprofits around Iowa that receive food from the food banks. So even though there are 8 food banks, let's go to there are 8 food banks in Iowa. Food banks and food pantries with the general public are usually intermixed. So food pantry and food banks are different, but in the food banking world they can be used either way. But food banks are the distributors, and you might say the distribution centers for food. So 8 food banks all the way up northwest Sioux City covers the counties up northwest. There's a food bank in Omaha. They cover the southwest 8 counties in Iowa. The Food Bank of Iowa here in Des Moines, they cover about 45 counties all the way from the south up to the north. That's the green. And the southeast Iowa is in a Tumba Food Bank. Northeast Iowa, 16 counties up in northeast Iowa in Waterloo. And Haycap Food Reservoir in Hiawatha over in Cedar Rapids is the purple. And then the few counties on the right, Riverbend Food Bank, they're in Davenport. They just moved from Moines to Davenport. And then Dubuque up in the just below where Dubuque is, they're the pink. They cover some of that in part of Illinois as well. So that is the food banks that serve all the counties. So we do serve all 99 counties, over 1,000 different organizations, serving the 389,000 hungry Iowans. So real briefly, I mentioned that. We're going to skip through that. So here's a look at Iowa. If you go to Map the Meal Gap, if you type in Google, that's a verb now. If you Google Map the Meal Gap, Feeding America, you'll come to this site. You can zoom into Iowa, and then you can zoom further into each county and see what the food insecurity rate is for each county. In Iowa, it's 12.7%. So 389,000 Iowans are food insecure, which means they're unable to get access, their lack of access to lack of access to food, or to lead a healthy, active lifestyle. And there is a nutritious food component in there. It's also the ability to get the nutritious food that they need. So that is where this all ties in. I forgot to mention up front, the food banks and the association have been wanting to get together and get partnerships going with the nutritionists and the dietitians. Well, we have everybody in this room, so that's great for me. But anyway, this is something that we are working on at the food bank level, is bringing in more nutritious food and forming these backpacks with more nutritious food that meet the guidelines for children. So that is something we are working on, and we've made great strides in the past few years, and we continue to. Now going to children, it was on the last slide, but 1 in 5 children in Iowa are hungry. I'll stay centered so you catch the microphone. So 1 in 5 children are hungry. 19.3% of the total population of children in Iowa do not know where their next meal is coming from. And that's 1 in 5 children. So if you have 20 children standing up here, you pull 4 out, they're all going to be hungry. And that's, and we don't think that's right. And I know you guys don't either. So that's what we're working on. Hunger in America. Now, this is a study. If you were at the World Food Prize, the Iowa Hunger Summit a few weeks ago, we released the numbers for this study that was just released back in September. So it's the most comprehensive study in the country. Every 4 years, Feeding America, they coordinate it, and food banks, they manage it at the local level, and volunteers down at the community level. So every 4 years, this study is conducted. So a few stats or numbers of who is hungry in Iowa. So 69% of clients identify themselves as white, 17% Black or African American, and 7% Hispanic or Latino. This is a study of about 2,500 pantry or emergency feeding agency users in the state. So 2,500 of food pantry clients. 31% are children under the age of 18. So 1 in 3 individuals come in or served by the food pantries are children. 11% are seniors. 23% of households have no members with health insurance of any kind. 6% of households have a household, or I think I missed what's it up there? Okay, 96% of households reside in non-temporary housing. And then the one thing I'd like to focus on that isn't up here, that we'll bring up later, is the top 3 most wanted or most requested items that are not currently being offered at food pantries. I say not being offered. Now, this is typically not offered because they're the items that are not donated very often. Dairy products such as milk, yogurt, and cheese. That's number 1 most desired is the word they use. Fresh fruits and fresh vegetables, and protein food items like meats. And that just tells you that the pantry users, they are focused on healthy foods. They do want that. It's just a matter of access, lack of affordability on the food bank's part, as well as the food pantry. So lack of access, so barriers to alleviating food insecurity. Now, I mentioned this. Now, this is something that is barriers for food banks and bringing in the food, but as well as barriers for the food pantry clients and hungry Iowans. So, the rural landscape, I think that's obvious. There's families in rural Iowa and counties where they have to drive 30 miles in order to get groceries, and some families just can't afford the gas, and some families just can't get out. So that's something that we'll mention later: the transportation of not just not just Iowans, but the food bank. So the largest cost for food banks is transportation, because they're shipping food all around the state, every county in Iowa, and getting that food out. And one thing that we are trying to help with the rural areas is the mobile food pantries. We're taking trucks out to the communities that maybe don't have the permanent food pantry and opening up a truck and feeding families in the communities. And there's lines 2 or 3 hours long, 100, 200 people in those. So. Let's see, the affordability and access to. So affordability is also obvious, because if you want the fresh fruits, vegetables, the milk, the protein, you will have to pay a little higher price than for maybe cereals, the sugary foods, the crackers, and stuff like that. So it's not just a lack of, or the affordability is the issue for clients, but it's also for food banks, because we don't get that donated. We're purchasing that more now than we ever have. And then storage. The storage at food pantries, this is an issue. So if producers come in with a bunch of produce, they may or may not be able to take it, because they don't necessarily have access, or they don't necessarily have the storage to that. One thing we're working on with the Department of Natural Resources and the UNI Waste Reduction Center is a swap grant, which we'll be releasing next January to food pantries. So we'll have 25 grants up to $1,000 available for food pantries to increase their capacity in the food for that fresh fruits, the perishable product. So we'll be $1,000 grants for them to purchase freezers or coolers. So we're trying to, it's all about forming those partnerships. I think we can get a lot more done if we all work together, which is why I think it's great having an opportunity to come speak with you guys. Now, I have misconceptions up there. I think that's, we see that more often with SNAP outreach, with the senior population. They don't, SNAP benefits, they're there for everybody, they're there for when you need them. But the seniors, they don't necessarily think they're for them. They don't want to use them. They think other people need them more than them. They think it's kind of a pride thing. So it's getting over that. They're there for help, and you don't need to be on them for long. You can just use them for as long as you want them. So, and of course the public policy. But I don't know that I'll get into that today. I think that's another discussion. But there's policies out there that you can improve in order to increase capacity, improve the production of and distribution of nutritious food. The food bank programs around the state. Now, I'm just going to go right through this. I'm going to focus on the Great American Milk Drive and the backpack program. I'll share a little bit about that. But SNAP outreach, they have the food distribution, that is to the agencies, to the pantries. The mobile food pantries I talked a little bit about. Kids Cafe, the elderly nutrition program, community gardens, which is neat if you've heard about the Newton facility, the correctional facility. They have, I think it's a 12-acre garden out there that those inmates that they work on that garden throughout, they harvest that, and some of that stays for their food and some stays or is shipped to the food bank and to give out. So nutrition education and backpack programs on the Great American Milk Drive. So let's get right into the backpack program. The food banks know a lot more about this, so I wish I also had a panel of food banks that could talk about this. So there's a little information on this slide. I'm going to read a little bit about this. So the backpack programs, if you're not familiar with it, it's designed to lessen the consequence of chronic childhood hunger. So these are backpacks that are either, the food is coming from the food bank. It's usually purchased because a lot of the food that needs to go in here for nutrition reasons need to be purchased. And this is packaged by volunteers a lot of the time, and then the backpacks are then taken to the schools, and the kids pick them up and take them home on the weekends. Because a lot of us, especially if we're in the schools, we hear that the kids, they have that consistent meal at school, and they look forward to coming back to school on Monday after the weekend because they're going to get, they have food there waiting for them. So the Food Bank of Siouxland, 1,950 backpacks a week for 33 weeks. The food included in this, a microwave meal cups, 2 cereals, a fruit cup, 2 shelf-stable milks, and 100% juice box. And the children that are receiving this, they're usually at the schools that are high in the free and reduced meal program. So up in this Northwest Iowa, it's 73% to 92% of the free and reduced lunch program. The Food Bank of Heartland over in Omaha, Southwest Iowa, $1,300 per week in Iowa. And they also cover all of Nebraska, which they have a total of 8,500 backpacks per week. So they have similar, the entrees, the cereals, milks, and juices. So it's easy, kid-friendly food that they're able to eat on their own and prepare on their own. And their food is all USDA foods to encourage, except maybe the entrees because of, I think the sodium is the second category. Northeast Iowa, they're always expanding. Now this is a program that they're always expanding across the food bank. So they're more than 90,000 food backpacks last year. And they also have about the same, the fruit, the vegetables, the snack, and the cereal, and the meals. I failed to mention that front. Now the Food Bank of Iowa and other food banks have as well, but they specifically wanted me to mention that they have, every year they have a group of nutritionists and dietitians come in to go over the backpack products, but they want to be most nutritious, available, and cost efficient. So they do have, including Midwest area that they've been in, and others around the state, and they do look at that. So, and Food Bank of Iowa, they have 113 schools in 26 counties serving 4,500 kids each week. Now let's move on to the Great American Milk Drive. Now this is a great program. I mentioned milk was in the top 3 of most requested items. It is the least donated item. So what did National Dairy Council, Feeding America, and I believe the Academy of Nutrition Dietetics had a part in this, and offering this program to bring more milk into food pantries, to food banks, and then going out to families. So it's the first ever nationwide multi-year program to bring the milk into food pantries. So you can see on the bottom, if you go to www.milklife.com/give, you can find this, the image at the bottom, and you can scroll every state and see how they're doing. So it's nationwide, 115,000 gallons of milk have been donated nationwide. In Iowa, 4,409 gallons in Iowa, which is great. So food banks have been receiving this for a little over about a year. We had a kickoff in, I think it was May, I think it was, or June, I don't quite remember, but one success story, Riverbend. This is the food bank in Davenport. It's really wonderful to see how overjoyed our agencies are to receive these milk coupons. Many are not providing milk at all, and those who were providing milk were very happy they did not have to go purchase it. And in the Des Moines area, to date, we have received 300 milk coupons that have been distributed on our mobile pantries. The program is great because it allows us to provide fresh milk in locations where we would otherwise not be able to distribute due to lack of refrigeration in mobile sites. The other thing I would like to thank and give credit to is the dairy farmers. Over the last 4 years, they have provided over $200,000 for the purchase of the dairy products. And that has helped around the state in order to bring the food in for these backpack programs and other programs. I'm just going to get through, and I'm using my time, so I'm going to quickly scroll through. Our association did a nutrition education pilot project. Now this is moving toward the food bank side, but I want to focus on the bottom 3. The top 5, I think, bullet points, excuse me, are just there for reference. There isn't any significance. The number of those that were pulled does not make that a number to go off of. But the last 3, I think, are important. That 67% are likely, or very likely, to use recipe cards. These are pantry clients. Again, they do want that nutrition. They do want to know how to use and prepare this nutritious meals, fresh fruit and vegetables. 83% are likely and very likely to use the fruit or vegetables they received, and 74% are likely, very likely to read the newsletter and stop at a table again. So they are interested, and I think that's how we want to frame our messages: is that they do want to learn, they're there, they're willing, and they do want to hear about it. So, and then again, as we move forward, the food banks are always looking to feed more Iowans. They're looking to partner. That's down there. We really do want to partner with other organizations, because we know the food banks can't do it alone. It does take the whole state, it takes partners, it takes private, it takes public, it takes small groups, organizations to make a difference. So, and we are focusing on improving nutrition. So I've used my time. So we'll have questions later, I believe. So I'll bring Sandy up.
Good morning. I'm glad to be here to have the opportunity to share with you the role that school nutrition plays in combating childhood hunger. I'm starting with where we're at recently with school nutrition, but I think it's very important that we take a big step back and look at where things were before the school lunch program existed. In the early 40s, it was identified that many of the young men that were trying to be serving in the military were unable to meet those medical requirements, and about a third of them, it was related to their nutritional status. So in 1946, President Truman signed into authorization the use of federal funds for the school lunch program. And a few years ago, I was reading a book that had as one of the characters a young man, or a young boy actually, who was characterized as the school bully, not doing well in school, and during lunchtime chose to take his lunch bucket and sit off by himself. Well, as the story unfolded, it was identified that the reason that he went off by himself to eat his lunch, and again this was said in the 1930s before the school lunch program was available, was that his lunch bucket was empty. And while it was a fictional book, I think that there were many instances where kids didn't have food that was available. So thankfully we do have these safety nets like the school lunch program, like the food bank, that does provide food for our kids. And more recently, school meals have been in focus of making sure that we're providing healthful meals, because in the early 1900s the issue was adequate calories. Now we're focused on making sure that those calories are healthful calories. And we're making a lot of strides, and I think that if you haven't heard about school lunch in the news, you haven't been reading the paper or listening to the news in the last few years, because it is a hot topic. And we're really focusing on the school environment, making sure that we're offering healthful items to kids, and rather than focusing on just meeting their calorie needs, making sure that we're meeting nutritional needs as well. Certainly I'm speaking to the choir when we talk about what you're eating matters. We all know as dietitians that the importance of a good diet does affect health, brain development, and certainly when it comes to schools, those kids that aren't getting healthful diets are negatively impacted. In Iowa, we're not quite as high as the 1 in 4 statewide, but actually in Des Moines schools, 3 of 4 almost of our students are in a food insecure situation. So making sure that we have the resources of a healthful diet are extremely important in both the outcome of their education as well as their overall health. And healthy kids are certainly going to be better students. Now, as a mom and a registered dietitian until about 7 years ago when I started in school nutrition, my focus was more on, as a mom, look at the menu that's on the refrigerator and what's for lunch today. And as a dietitian, again, that focus on, are we providing healthful foods? Are they reasonable levels of fat and sugar and sodium? But the reality is that there's over 20 million kids in the United States that rely on school lunch on a day-to-day basis for that meal. So it really is important in combating hunger. In Des Moines schools, we serve about 22,000 lunches a day and 11,000 breakfasts. And about 70% of our kids do qualify for free or reduced meals. So again, if we didn't have those programs, they might be the kid that doesn't have lunch, isn't able to focus in the classroom. For many of our students, we hear, well, or we have parents who are packing lunches, which is great. We have fantastic lunches that are packed by parents, but there is definite research that shows that school lunches are nutritious, and in fact, in many instances, more nutritious than what is being packed by parents. And in some instances, as you're walking through the cafeteria, you realize that it's not just the parents that are packing the lunches, it's probably the kids that are putting a bag of cookies in their lunch and calling it good. Certainly, we've heard some negative and continue from a student's perspective on the reduced sodium and reduced sugar, more healthful offerings, the requirement of fruits and vegetables. But we're seeing a turning in the tide. We're seeing parents that are really supporting the fact that we are offering healthful foods. So I guess the message that we want to make sure that all dietitians are conveying to parents is that certainly whether you're needing to participate in school lunch because of the opportunity to receive a free or reduced meal, or you're just choosing to make sure that your child has a nutritious meal, that these meals are more and more helpful each year as we have more specific guidelines for those nutritional requirements. As you probably are aware, income is what determines whether or not a student will receive a free or reduced price meal. And just to put that into perspective, again, the guidelines for a free meal is 130% or below of the federal poverty level, and then to receive a reduced price meal, it's 185% or below or above that 130%. So looking at a household of 4, for free meals, that household cannot earn more than $31,005 per year. For a reduced price, again, it can be above that amount or below the $44,123. Now, we have a new program that is just available this year called Community Eligibility. And one thing that overall has been very well received, very positive input on the fact that we're able to provide no-cost meals to more students. But one thing that has come up is, why don't you continue with the old system? We were providing free and reduced price meals to kids. The application process identified those kids that needed those meals. Why are you expanding that program? The reality is that, again, going back to those income guidelines, if a household, for instance, of 4 had an income of $45,000, they do not qualify for a free or reduced price meal. And the number of calls that I personally received each year of households who were having challenges paying bills because of medical issues due to other financial burdens that they had were significant. And so the community eligibility provision looks at schools that have a high number of free or reduced price meals that are being served. And actually it's based on those students that are identified as qualifying directly for free or reduced price meals. So that would include our homeless, migrant, foster children, as well as households that are receiving supplemental nutrition assistance and FIP assistance. So if a school has more than 40% of those students that are directly qualified for those free meals, we do have the opportunity to say, we no longer have to collect applications from individual families. We can go ahead and feed those schools at no cost. We were fortunate in Des Moines that we could, this year, start serving 35 schools meals at no cost, as well as three of our early childhood programs. And again, one example of the impact that makes is in talking with one of the principals at a school that is community eligible. She was saying, this is so great. Before, as in last year, Her school was a school where kids had to fill out applications for a variety of reasons. Families either weren't filling out applications or didn't meet those income criteria. And again, those were the kids that were putting a bag of cookies in their lunchbox or a lunch bag and bringing it to school. She said that the opportunity to have a much more nutritious meal for those kids is amazing, and they're really seeing the change in behavior with kids, and also the issue of whether or not children are keeping current with paying their fees, etc., has been minimized significantly. Another program that we implemented within the last few years is breakfast in the classroom. Prior to community eligibility, we did have 12 schools where we were able to provide meals at no cost to children based on income applications. But even at those schools where the issue was not whether or not the meal, there was cost associated with that meal, we had poor participation. District-wide, we were at about 20 to 25% of our kids participating in breakfast. And I would like to say that that's because the other 75% were having breakfast at home. But we know that that's really not the case. Kids were getting to school late because of the bus. They were being dropped off late by parents, or more significantly, they were on the playground with their friends who would say, well, I already ate breakfast. I'm not going to go into the cafeteria and have breakfast. I don't need it. And again, there's not too many second graders who are going to stand up and say, well, I'm going to go in and I don't care if my friends aren't going to eat breakfast. So breakfast in the classroom has allowed us at initially 15 schools, and this year we've expanded so that we have a program at 22 of our schools to provide a breakfast at no cost to all the children at that school. They come in the door, they get a complete breakfast, they take it to their classroom, and it's incorporated into the school day. Again, it's allowing kids to make sure that they had that breakfast, and certainly the input from principals is that behavior has improved, attendance has improved, and even the issues with tardiness that they had, kids are anxious to get to school to make sure that they have breakfast with their friends. Another opportunity that is available for our low-income students is the Fresh Fruit and Vegetable Program. We're currently able to provide at 27 of our elementary schools a fresh fruit and vegetable snack on a daily basis. Again, trying to expose kids to the nutritional benefits of fresh fruits and vegetables, exposing them to some new fresh fruits and vegetables. And we've really seen, as we've had the program, that the program was piloted in some Des Moines schools, but available nationwide in 2006. And over those years, have seen more acceptance of fruits and vegetables as part of the school meal program, and more children that have been exposed to the fresh fruit and vegetable program selecting those fruits and vegetables. Another great program we have is our Pick a Better Snack that is funded by SNAP Ed. And I'm going to put a few people on the spot because I know there's a few of you in the audience who have worked with our program, so raise your hand. Very good, thank you. Our program is at over 300 K through third grade classrooms. We have a full-time individual, Lynn Jenkins, who does a fantastic job of coordinating the program, but for her to get into 300 classrooms each month is physically impossible. So we really depend on a lot of dietitians. We have interns who are in the classrooms. We have food corps members that are in the classrooms. And each month they're bringing in a sampling of a healthy snack and a nutrition education lesson. And it is really fun to see what they're learning. Senator Harkin actually visited one of our elementary schools the week before last. And he was talking to them, again, more specifically about the fresh fruit and vegetable program, but they were all filling him in on jicama and what jicama was, and so we knew that they got their facts. And if you see any kids from Des Moines schools, this this month with puckered up lips, it's because it's cranberries this month. So they're actually sampling a fresh cranberries. So we're anticipating some fun faces with that. And of course, summer meals is a very important program that's available in neighborhoods where at least 50% of the students qualify for free or reduced price meals. Certainly if there's a need during the summer or during the school year for those no-cost meals, that need continues during the summer. So we have available in park sites and at schools, meals at no cost, lunches, and at some sites, breakfast for kids. Again, this doesn't require an application, it's just showing up to receive that meal. So we've continued to expand that, but we know that we're certainly not reaching all the kids that we can. So as you're working with families, if you have an opportunity to promote the availability of summer meals, please do so. And I want to make sure that Dee has enough time to cover her information. So I won't spend a lot of time on special diets, but I'm going to put another group of individuals on the spot. I see some fellow lunch ladies out there. So raise your hands. Very good. That's it. Certainly do reach out to them in terms of some of the unique challenges that we're facing in terms of meeting the needs of kids with special diets. We are required to provide special meals if a child has a disability. We do require a written doctor's statement. Encourage you as you're working with physicians and providing that information to schools to make sure you're providing us details. For instance, we get some that are fairly vague. It needs to be high calorie or low calorie. Again, our meals have become more and more low calorie, so it could be that a child who is needing to restrict calories really doesn't need to modify the school lunch much. But for instance, a high calorie, we have several kids in our district who have cystic fibrosis, and we have to increase their calories and provide them whole milk. Again, whole milk is not a standard item that we provide to kids because we're going towards more healthful offerings. So working with the district, a lot of times it's the school nurse who is coordinating things at the school level. Again, I'm very blessed in the Des Moines schools to also have a full-time or a dietitian as a resource that's working exclusively with our special diets. As you might have low-income families that are in smaller districts, your help is greatly appreciated. And I'd also put a plug in for those of you who want to branch out into school nutrition as a career option. With the nutritional demands, requirements that we have, and the special diets, I see that as a real growth opportunity. It's a great area to be involved with, great to interact with the kids, and we really do need the support of the dietitian. And then just one last piece before I hand this off to Dee. Certainly, as you are promoting lunches, if there's always at the start of the school year great pieces on what families can do to pack a healthful, nutritious lunch, which is, they're always great ideas. But as we're working with the low-income families, if you can just put a plug in about the healthfulness and appropriateness of the school meals so that our low-income families that are relying on those meals each day feel comfortable that it's not that they're slighting their kids by providing them school lunch, but you're providing some options if they've got a picky eater, etc. So with that, I will hand it over to Dee.
It's actually quite scary knowing I'm the only thing standing between you and lunch. So, that's it. I'm going to begin with the end in mind, which are a couple of thoughts. Basically, the summary of my talk is we're going to talk about how the Academy, through the future of food, and you'll learn what that is, partnerships, is the linking agriculture, food and nutrition and health. So we're going to see how that's happening. And much of what I am going to talk about is on this resource, which is on the website for this meeting. So if you see some websites you want, don't feel like you have to take copious notes. I managed to get probably 100 hard copies of this when I was at Fancy. So that said, we'll get started. And to tag on the Pick a Better Snack, last night I was doing a store tour for some Cub Scouts who were in first grade. And when we were in the produce department, you know, we went to more of the unusual produce. I said, well, does anybody know what this is? And they go, yeah, jicama, because that lady with the snack program came and we tasted it. So that was good to know. And then day before I was in a fourth grade classroom and talking about sugar. And the teacher said, well, I just got a call from the Pick a Better Snack person, and she's coming next week. So it's nice to know that they are out and helping. So today, we're going to talk about the raising our awareness as Academy members about the prevalence and consequences of food and nutrition and insecurity for the nation, including the Academy initiatives, and that's really what I'll be talking about. And also that we can take action at local and state levels, and I'll also talk about some things we're doing there, and to improve nutrition and food security, insecurity at the national level. Now, what is this partnership for the future of food? It is an education, communications, and research initiative that addresses domestic and global food and nutrition security, consumers' interest in safe and healthy food supply. And it's a partnership between the National Dairy Council, Feeding America, and the Academy. It also coincides with the Academy's strategic plan, which includes a mission to optimize the nation's health through food and nutrition, and the Academy's mission to be the nation's food and nutrition leader, and that dietitians are the experts, of course, in food and nutrition. And so all this has come together, and how this partnership for the future of food works is that it consists of 10 representatives from Feeding America Network, 4 from the Academy, and 2 from the Dairy Council Network, plus national staff from all 3 of the partners. So they've shared best practices from a respective of organizations that have great insight and impact into food and nutrition. And new kid on the block, agriculture. So the Future of Food Partnership has 3 different kind of buckets. It's awareness, education, and access. So it started in about 2012, and so reviewing some things that have already taken place, Feeding America is the nation's leading domestic hunger relief charity. Its mission is to feed America's hungry through the nationwide food banks, and also the partnership through that have come up with a website, healthyfoodbankhub.org, which has lots of resources for us to use with as we volunteer at food banks in food insecure populations. So it's a system that vets the recipes and has dietetic internship possibilities. And also the Academy has started some hunger in our community mini grants, and you can get $200 as an Academy member to do that. Has anybody done that? Can we see those? I did that. It's the easiest grant you can ever apply for, and I did this a couple of years ago. And these toolkits are already written, so you talk to a couple community groups, which many of us do in our day jobs anyway, so it really works out well, and there's a lot of variety, and of course the website's on here where you can learn more about that. So as far as education, the Academy is conducting webinar series for Academy members, and in the House of Delegates in 2013, hunger was a mega issue, and from that came examples of what's going on throughout the country, and also this year, in 2014, Fancy was in Atlanta And after the Saturday session, about 35 delegates went and volunteered at the Atlanta Food Bank. I was not able to go because I had another meeting to go to, but my roommate went there and she said it was really quite moving and meaningful to have done that. And also through education, there's promotion of hunger toolkits and web-based resources. There's also going to be an RD intern concentration on hunger and food insecurity, which is, one of the new areas that will be coming for interns concentrations. So as of February 1st in 2014, a lot has happened, and since then, we've had FNC and some more programs unfolding. So in 2013, at the virtual meeting for the House of Delegates in the spring, basically what happened was the Food and Nutrition Security Task Force developed plans and strategies. And so there was a task force formed, and so a lot of this work that I just talked about, some of the outcomes, especially through the webinars and toolkits, have come as part of that. And I want to spend a little time on this infographic because it's really probably the one slide that there is a web link to it. If you start at the top on number 1, so the infographics to work to increase availability of foods and nutrition education in food banks. So one of the toolkits and webinars is about how we as RDs can do that. It gives us proper ways to maybe position nutrition terminology and sort resources we can use. And 2 at the top right is to enlist registered dietitian nutritionists in the food banks. I can tell you I have worked in a couple different Hy-Vee stores, and in one community I was able to go there once a month and do a class. And how they got attendance up, they required people to come and sign in for part of what they collected. I guess they had to come to so many activities, and so we had pretty good attendance. In the community I'm in now, we don't have room in our food bank to do a class. So regardless of your work setting, you can work in a hospital, you can be consulting, you can volunteer, you can be in public health, you can go in and do a class at the food bank. They really welcome it. Number 3, learn evidence-based solutions to decrease obesity. One of the free toolkit and webinars is the dichotomy between how can we be hungry and overweight and all the potential chronic health risks that will come with that. Number 4, encourage participation in school meal programs, which was already covered. And then 5, advocate for expanded meal programs. And I want to talk a little bit about, Cory talked about the backpack program. Well, in our community, just this year we started a carry-on bags program because we're not in a food bank town, but we have a food pantry. And so the backpack program is unique to the food banks. But in our county, what happened was some teachers noticed that there was a high school girl that came to school and fainted on Monday. And they're like, what can we do about this? She hadn't eaten all weekend. And I think many of us assume that people eat. Well, not all people eat on the weekend for multiple reasons. And so through this, a group of schools, interested people, and we heard about it, got involved in that, and one of the churches in town is actually where we're packing the backpacks. So every 2 weeks, we go and pack we have 315 kids on this in a school system of 1,247. So we do 730 backpacks because we pack for 2 weeks at a time. The budgeted price we tried to work out was $250 per backpack. Well, we've already exceeded that. And so we last time had to have a board meeting and say, okay, we got to cut this back a little bit. But we were putting things in like tuna, top ramen, oatmeal, granola bars, applesauce, just to name a few. Now, we all want to have, and already the question came up, which of course I got that one, well, why can't we get more nutritious foods? Well, yeah, that's great. So what we can do, we can offer no added sugar applesauce instead of sugared applesauce. We can also offer regular oatmeal instead of flavored oatmeal. So there's little things that we can do within the same budget. But there's a real need for this, and part of what we have done is people do not have to qualify. Anyone can sign up because we don't want that to be a barrier for anyone. And so one of the teachers told me that she was in the break room one day, and there's usually, I'm sure, a few bags that don't get picked up. And just one morning, some student had come to school hungry, and so the teacher had taken some soup out of that backpack bag to heat up, so they're getting used in other ways too. So this is somebody through any organization, churches, schools, get your local stores involved. It's a really good service to provide. Okay, the food webinars that the Academy offers. We have the future of food. I think I skipped one. There we go. And there's lots of different ones. Hungry and overweight, how is it possible? School meals, point A to B, improving access to healthy food banks. How flavorful pairing, nutrition education, how to message. So these are all free. There's CEUs available. And this is the new one. So you cannot see my t-shirt, but it says eating is an agriculture of act. And I got this at Fancy because one of the new focuses of the webinars they're doing is to educate dietitians about where food comes from. And as a farmer, I've always felt that. When I lived on the West Coast, it really became clear. Here in Iowa, we have a pretty well sense, but we can't assume that everybody knows where food comes from. But it was like, boy, if I ever get back to Iowa, we're going to have this mission and educate people where food comes from. And so it's really great to see the Academy and the Future of Food partnerships are doing this. And so there's already been three of them, I guess, take place. The first one was foundational understanding. And the second one is farm economics and the challenges, the impact of the Farm Bill, which of course 80% is SNAP related, and more resources about how we can get involved. So all this is available. You can even print out the handouts if you don't have time all at once to listen to the webinars, but there's great information. And I am actually on a committee of RD farm experts that have been helping to develop some of these. So coming forth in 2015, through some wonderful, helpful information from the Dairy Council and Elanco, we're going to have 37 states that are going to have the presentation next year, changing the way we look at agriculture. And what this is going to provide meaningful opportunities for members and their own affiliates to be more connected to agriculture. And so Elanco is actually going to sponsor 10 affiliates, and the Dairy Council will be sponsoring the rest. And what they did was they opened this up to 10 states affiliates at first, and there was such an overwhelming project that the National Dairy Council had said, okay, we'll help fund the rest of these. So throughout the country next year, all these states are going to get the presentation, and I believe it possibly could happen here. So that's something to look forward to. What these presentations are going to do is actually look also globally at what's going on and gain an understanding of the current state of the U.S. versus international farming. At FNCE, there were a lot of sessions this year on global and how we are so interconnected global in our food supply, plus our challenges with micronutrient, not having enough of them in some countries. Learn innovative strategies to help nutritiously feed our world's population and how we can take action. So we will be learning that next year. So some resources and tools in the effort of time are pretty much on here, but I can say the easiest ones are the Kids Eat Right through the foundation. Register as a volunteer. It's really simple to do. There's no cost associated with it. And you can get the continuing education from these webinars and also apply for the mini grant. So it's really helpful. You get a PowerPoint plus the speaker notes that you can just take and use. And I'm actually on a committee that we're developing one that'll be out, they hope in February, that'll be on partially the national and global food insecurity and what we can do about it. So here's some of the different resources, and I guess that's it. One thing, when Cory was talking about the food banks, that we could easily do in all of our hometowns or even throughout parts of the state for fundraising. When we were in the Vancouver, Washington area, we were part of the Portland, Oregon metro area, and every year on the 4th of July they had a 5-day food festival and brought in bands from all over the country, and the price of admission was for the Portland Food Bank, and it was at that time only $5 a day or 2 cans of food, and that was a really good way to resupply the food bank and raise some money.
All right, thank you very much. And due to time, is there any questions? If not, we can always have you talk to them on the side. 1 or 2 questions? Food for thought? All right, great. Let's thank our